Hi, this is Amy from Love to Live VSG, and I'm making a video today on pre-op. What do you have to do to get approved for weight loss surgery? First thing, you have to be qualified. How do you do that? Most qualified people have to have a BMI of 35 and above with 2 comorbidities. Okay, what are comorbidities? High blood pressure, high cholesterol, sleep apnea, things that are related to being obese. You've got 2 of those and your BMI is 35 or above, you qualify. Or if your BMI is 40 or above and no comorbidities. I mean, you can have comorbidities, but you don't always have to if you are your BMI is above 40. There's BMI calculators. I'm not going to tell you how to do it. It's basically a weight to height ratio, and it gives you a number. Mine's in the high 40s. I don't know it exactly, but it's up there. So that's what you have to be qualified. Now, every insurance company is different, and I'm sorry to tell you that because it stinks. You could have Blue Cross, your best friend could have Blue Cross, and not both of you get approved. I'm not going to give insurance company names in this video only because of that reason. I personally was denied 11 years ago for the VSG. My next door neighbor also had the same insurance, which at the time was Blue Cross, and she was approved instantly. I was actually heavier than her and needed it more than she did, and I was denied, and she was approved. Just a luck of the draw of who got the approvals, whose department. Her approval department and my approval department were different. They were different people. So it just happened to be that she got the more favorable outcome than I did. You know, it happens. So don't think that best friend Sally has Blue Cross, and I'm just using that as an example because, you know, it's the only one I can think of off the top of my head. Alright, she has it, she got approved, I have it, I'm going to get approved. It doesn't work that way. I'm sorry, but it doesn't. The employer you have insurance with might have excluded weight loss surgery in their policy. So you might not be covered for any weight loss surgery no matter what it is because your employer said no, we're not covering that procedures. You know, that happens. Ask your job, ask your health insurance, get your book out, look and see what you're qualified for. Investigate it. You may even be able to find out what you need to do to get weight loss surgery. I wasn't that lucky. I saw so many different things online. Get on their website, look. That didn't help me very much because I got so many different reports. I wasn't sure if I was looking in the right place. I called my insurance company. They said get your surgeon's office, your physician's office to call, and then we'll talk to them and tell them what you need to do. We won't tell you. Okay, that didn't help me. My next suggestion of a pre-op wanting to have surgery, talk to your primary care physician. Talk to them about weight loss surgery. Get them to write in their report that day that you were there as a weight loss surgery visit. Why? Because your insurance company may require 6 visits or 3 visits or a year's worth of visits. There have been people, I personally know somebody that's been required to do a whole entire year worth of classes before she could get approved. It happens. Mine was 6 months. I went to my primary care physician. We talked about weight loss surgery. In that process, I got a referral from him. Some insurance companies require your primary care physician to be on board with you having surgery. They require them to actually refer you and to say, yes, he is a good candidate. I am supportive of this procedure for this person. And a letter, you actually have to have a letter. Some insurance companies require a letter from you why you want to have surgery. How would it benefit you? I mean, it's a letter from you to them. Why? My insurance company required 6 visits in 6 consecutive months, 1 per month. So my first one with my primary care was in March. I figured out that I thought that this is what they required before I went to see my surgeon, because remember, that's who they said I had to talk to in order to find out what I needed. So I went and saw my primary care in March. I'm going to go again in April. So I did. Again, weight loss related. It was notes for surgery. I explained to him this is what I thought my insurance company required, was 6 consecutive visits in 6 months. And what I mean by consecutive, March, April, May, June, July, August. 1 visit per month for 6 months in a row. That's what I thought my insurance company required. My appointment wasn't till May with my surgeon. I didn't want to lose March and April. I'd already been to him in March. I didn't want to lose April. So I went to him and I saw him again. If it was a wasted visit, it was a wasted visit. But if it wasn't, hey, I'm 2 months closer than I would be if I waited till May, right? So I did it. So, May I go to see my surgeon. Insurance guy, absolutely wonderful. Gives me a paper and says 6 consecutive visits, 6 consecutive months, 1 visit per month, and a minimum of 3 of the 6 have to be here at my surgeon's office. So I thought, okay, today count as 1? He said, yes, absolutely it does. Went to a seminar. Was there from 9 a.m. till, no, 8 a.m. till 2 p.m. They did a lot of stuff. We went through a seminar. There was probably 10 of us. Then we all went downstairs and had blood drawn. They tested us for H. pylori. Another video, another day. Basically, it's an infection in your stomach, bacteria in your stomach. They can give ulcers and stomach cancer. They put you on medicine. It goes. So anyway, that visit was a long day. Then I saw the nutritionist, and then I met with the surgeon, and he just did a 10-15 minute appointment, took your blood pressure. The nurse took that, but he checked me. What surgery am I interested in? Do I qualify for the surgery? Am I a good candidate for the surgery? He said I was. Just discussed back and forth about the surgery. It was a long day. It was worth it. But anyway. So I went back and I did my June, July, and August. And May, June, July, and August. Yeah, I did 4 months with him. So I met the requirement of the 3 minimum with him. I did 4. Now, when we went, because some insurance companies require you to have your visits a certain amount of days apart. My insurance guy with my surgeon's office said, my insurance usually isn't that picky as far as they have to be this many days apart, or they can't be this many days close, they have to, there's no like day limit. Some insurance companies I've heard do require you to have a certain amount of days apart. So you need to check that when making your appointments. And when you're at your surgeon's office, they'll know this. I mean, they'll take care of you. They'll know it. If they don't, and they act like they just completely don't know what they're doing, find another surgeon's office. I'm sorry, but find another one, because, I mean, granted, you may have this off-the-wall insurance, but that's their job. I'm sorry, it's their job. That insurance guy's job is to know what I need to do to qualify. If he doesn't know, because nobody can know everything, then it's his job to find out. And if they don't do that, go to somebody else. You don't want to be denied because they didn't do what they were supposed to do. So I did my 6 months. Some surgeons require, now some of these requirements can be surgeon required, some of them can be insurance required. If your insurance requires testing, like your endoscopy, sleep study, ultrasounds, chest x-rays, heart cardiologist appointments, you know, if you've ever had any problems in the past, you might need to be cleared through a cardiologist. You might need to be cleared through a pulmonologist about your lungs. There's a lot of other things that can go on that you have to be cleared through. If your insurance company requires them, you're going to have them done before you get approved. If you're like my case, where my surgeon is the one that wants these tests, then you can be like me and get your approval and then schedule the test, because the surgeon's the one that wants them. And if he's not going to put me through an endoscopy for the surgery if I'm not approved, because then, you know, we've wasted time, money, and effort, you know, unless I'm having issues. If you're having issues, then they may go ahead and do it anyway, but if not, it's not, you know. In these 6-month visits, or year, or 3 months, you may be required to lose a certain percentage of your weight on your own. Shadow, that's my puppy. My surgeon did not require that. My insurance didn't require that. My insurance said, you go see your doctor 6 months, 6 times in 6 months. You learn what it's like to be post-op, learn what your nutrition's going to be like, see if this is really something you still want to do, and then there was no weight requirement. Some surgeons will make you lose a certain percentage of your weight because you're just too heavy. You're too heavy, he's not comfortable, he, she is not comfortable doing surgery on you at that weight. It's not safe. Then you need to lose it. And I don't know how to tell you how to do that, because if you can do that on your own, maybe we don't need surgery. But it's not usually a huge amount of weight. It's sometimes 10%, 5%, whatever that equals to for your weight. The heavier you are, usually the easier and the faster you lose, or you can lose, and that's what those 6 months would be for you, is to get you on a program that shows you can lose it and that you're going to do well after. Now just for a second, I'm going to talk about pre-op diet. Some surgeons require 2 weeks of full liquids. Some require full or clear liquids for 2 meals and then a light meal at night, like a protein and a vegetable at night, and that's it. Some require 2 or 3 days before nothing but clear liquids, and then a couple days before that full liquids. And there's a difference between full and clear. Full liquids includes a little bit more, and I'm not going to go into all the details on that. You can look that up. Just Google full liquid diet or clear liquid diet. And my surgeon's office requires clear liquids the day before surgery, and that nasty magnesium citrate, whatever you say, that nasty laxative, that Go Lightly stuff. Remember, you used to call it Go Lightly? Yeah, that stuff. You can get it, I think, at like Walmart, CVS, Walgreens, department, you know, pharmacy kind of places. My surgeon requires clear liquids that day and that stuff to drink, and requires you to take a shower with this betadine antibacterial solution stuff, and that's pretty much it he requires. Pre-op is a scary time. It's exciting and it's nerve-wracking, and there's a lot of hoops to jump through. And another reason why you might want to see your primary care physician, even if your insurance doesn't require you to, if your surgeon is a couple of hours away and you don't want to continue to travel to him after he can release you, and that can be different times, you know, it's up to the surgeon as to when they release you and all that, but your primary care physician can fill in for that, can do your lab work. Check your iron, your vitamin levels, your B12, D3, all those vitamin levels that you have to have checked. Your calcium, all that wonderful stuff you have to take after weight loss surgery. It needs to be monitored by somebody. And if your surgeon's far away, or you would rather go to your primary care, if your primary care surgeon's not on board, are they going to do that? Are they going to allow you to come there for your follow-ups, or are you going to have to go back to your surgeon 2 or 3 hours away? That's something you need to discuss beforehand. Honestly, I went to mine because if he was going to say no, I was going to go to another surgeon. Another primary care. I was going to switch doctors. But he didn't. He said yes. He was very up on board, and I didn't have to worry about that. But those things you got to think of too. So I hope this was helpful. Please ask any questions. I'm still pre-op, so I can't answer post-op questions. I just wanted to come on here today from one pre-op to another and tell you that I understand what you're going through, because I'm doing it right now. All the post-ops do too, but they've moved on. They are post-op. They're in the promised land, and they have their own new set of things to deal with. And I just wanted to answer some questions for you to see what you needed to do to get to their side of the bench. So I want to be on the loser's bench, and it's coming. So I hope this was helpful, and see you soon. Bye.